Medicare D prescription drug plan? Okay, so when we did that, that tightened that formulary, different from the commercial plan. The under 65 people are still on the commercial plan like the actives. So, and that is a very broad formulary. It's their preferred net with Express Scripts. The EGWP plan's a little bit tighter. So we have made an incremental change. Now, we will receive more rebates and we will receive better discounts, but we are only, at the time the underwriting was done, we're 6-7 months into the program. So hopefully by 2015, we're going to see greater benefit by going to that tighter formulary for the retirees over 65. And that is a really large group. That's like around 1,200 people, contracts, plus their spouses usually. So that's a big group of people that are on that EGWP plan, and particularly they're on that standard plan design, which has the lower copays than what our alternate plan does. So if we get some migration this year because some price sensitivity may kick in, we'll get some people to move to those other plans. So we've tried. We're pushing that direction.
And is some of the increase in the utilization because the number of participants is going up, or are our participants using more medicine?
Participants are using more medicine.
Okay.
And you see that on the inpatient and the outpatient, both side of the house. And I don't know why. I don't see anything particularly that tells me that they're more sick than they've been in the past. There's just more utilization going on.
All right, any other questions?
Let me say that I have volunteered to unilaterally move off the existing plan until death row.
And let me just say we're checking into that.
And I'm going at the retirees tomorrow. In fact, I've done the other two groups. You know, we're trying to get people to move to the alternate plan, which has a little higher deductible, but it's a cost savings for the member and the municipality. And if they'd also move to the Secure Horizons Medicare Advantage plan, that would be another cost savings. And we've got a lot of resistance about retirees moving from that standard plan where most of our people sit to get them to move. That would, so anyway, that's the message I'm trying to do, because they're complaining about the cost and the premiums, and so do that.
And I also, Mr. Chair, just want to mention that earlier this year we were able to achieve legislative changes at the state capitol regarding insurance for retirees, which will allow us to offer more flexible plans, more cost-effective plans. So we will be researching that within the next few months.
Great.
And did you want me to address the HMO rule?
Yes.
That one was the Secure Horizons is a federally approved plan, and we don't have much control over that. So those rate increases was what's approved by the Medicaid and Medicare services. And then the other plan went up 7% for the retirees under 65, and that seems pretty reasonable for what the market is doing right now on the HMO side of the house. Pretty straightforward.
I have another question. The increase for the under 65s, is that comparable to the increase that we had for active employees?
It was the same. They priced them the same.
Okay, thank you.
7%. Anything else?
All right, thank you, Colin.
Thank you.
So I would take a motion on item 5, which is the stop-loss administrative services.
Move the item.
All in favor? Any opposed? Next item, item 6, is the dental plan.
Move the item.
All in favor? Any opposed? And then item 7 is the administrative services agreement for the payments on the health care costs for the health plan for United Healthcare.
Move the item.
All in favor? Any opposed? All right, I want to move back to item 4 real quickly. I was supposed to explain something to you. I told Dick I was going to do it, and then I didn't do it. On item 4, there was one issue on the Nyhart contract with their insurance renewal, that there's a provision that they're supposed to give us a 30-day notice of if the insurances that they're required to keep, the liability insurance and other coverage that they're required to have within the contract. Their insurance certificate expires one expires in January and one in April, I think it is. And there isn't a specific provision that they would notify us 30 days in advance. And so what they've said is that they're definitely going to renew that, and what they'll do is provide us renewed certificates. Since it doesn't work with our contract timing, they'll provide us the renewed certificates once that's completed, and then we'll just make sure that we follow up on that and keep you notified if there were any problem with that, but they've assured us they aren't going to do that. When we talked with legal about it, they said that they've had other issues like this before with some of the insurance companies, and it was fine to move ahead with the contract.
So the 30-day notification is only if they are going to terminate their insurance coverage, correct?
Yes.
Okay, thank you.
Yes, that's correct. All right. Item 8 is to ratify claims.
Move the item.
All in favor?
Aye.
Any opposed? Are there any reports or comments from trustees or staff? All right. Hearing none, we are adjourned.